Hello, I'm urologist Omar Erdamakaya. Today we are going to have a video presentation for you about clomid, clomiphene citrate. Clomid and clomid are the same substance but their brands are different. Clomiphene citrate is a substance that has been used since 70s in infertility treatment for both men and women. It is similar to estrogen Nolvadex as structure has a negative feedback on estrogen receptors. By the feedback we mean that it makes itself appear to have decreased estrogen in the blood. It's written as an estrogen antagonist in classic books. And when it's used, it increases estrogen, testosterone, follicle-stimulating hormone, and luteinizing hormone. It acts with estrogen-negative feedback mechanisms in the hypothalamus and hypophysis. Actually, it is a selective estrogen receptor modulator. That means it is a molecule that acts through the estrogen receptor. It's very old, it has been used in the world for more than 50 years. In urology, it's used commonly for hypogonadism, low testosterone, and male infertility. This substance was even used for weight loss in the past. One of the remarkable properties of clomiphene is its ability to simultaneously increase both follicle-stimulating hormone, FSH, and luteinizing hormone, LH, levels, which makes it quite unique compared to other medications. FSH, as mentioned earlier, stands for follicle-stimulating hormone and plays a crucial role in the human body. This hormone primarily regulates spermatogenesis, the process responsible for the production and maturation of sperm cells. By promoting spermatogenesis, FSH helps improve and expedite sperm production, making it a sought-after treatment for male infertility. Moreover, clomiphene has been utilized for years as a therapeutic option for individuals with hypogonadism, a condition characterized by inadequate gonadal function, leading to reduced testosterone production and, in turn, affecting various aspects of reproductive health. Although it is not officially approved by the FDA for this specific use, clomiphene's effectiveness and safety have encouraged its continued utilization in clinical practice. It doesn't cause testicle atrophy when used. As a side effect, it can rarely cause site problems and very rarely gynecomastia. As a healthcare professional, I have extensive experience using clomiphene in my clinic for several years, and I must emphasize that, in the majority of cases, I have not witnessed any serious adverse effects. The medication has demonstrated its efficacy and safety, further solidifying its position as a reliable option for managing male infertility and certain cases of hypogonadism. And apart from that, since it creates the FSH effect, it's very useful for PCT. In PCT, there are three medications used basically: HCG, human chorionic gonadotropin, tamoxifen, and clomiphene citrate. What's the duty of HCG? It is to create the LH effect. When the LH effect is created, the luteinizing hormone makes testicles release testosterone. But HCG also increases estrogen. And when we use clomiphene along with it, it also increases estrogen. So what happens? It's a necessity to use tamoxifen Nolvadex. The important thing in PCT is to increase both FSH and LH. Of course, clomiphene increases FSH, HCG increases LH. There is no HCG available these days. So they use Cormin instead, but now they can't find it as well. So there's Ovidrel, recombinant HCG. Ovidrel is a bit expensive. So people use Decapeptyl. Decapeptyl is a dangerous substance. The substance in Decapeptyl firstly makes a strong stimulation of LH which we call the flare effect. We use this in prostate cancer. But our aim is to make the testosterone totally zero, with Decapeptyl's depot form. Also for women, it's used for in vitro fertilization in low doses. Again, Decapeptyl is used but in a very low dose. The aim is again to zeroize the LH, but in the beginning, there's a high LH in the first a few weeks, so there can be an increase in testosterone. There can be an increase in testosterone in patients with prostate cancer. But in the following weeks, the testosterone goes to zero. Decapeptyl is dangerous, guys. This was asked a few times, so I wanted to answer briefly. Actually, all of the medications are dangerous. I would never recommend the use of any medication before a doctor's check. This video only aims to give information, not to treat. Clomid is cheap and safe. I believe it's a substance to use in hypogonadism. In my clinic, I use clomid often in hypogonadism honestly, and I'm satisfied with its results. What I mean is, when we use clomid, testosterone level doubles after the first month in hypogonadism, from 250 to 500 and 600. But of course, I don't use clomiphene alone. I certainly give herbal supplements and vitamin supplements. Because if the patient has low vitamin B12 or D, using Clomid alone doesn't work, in my opinion. Other vitamins are important too, selenium, zinc, magnesium, also herbal supplements are important. The patient's routines of eating, sports, sleep, and social status are important, nothing works alone. The amount of carbohydrates in the diet, and calorie restriction are important. I think, just giving Clomid and not following up with the patient doesn't work. Also, after quitting the medicine, the patient doesn't have testicular atrophy, a disruption in sperm quality, or needs PCT or something afterward. After using Clomid, it's possible to have physiological testosterone levels, which is enough. And in case the patient wants to have the physiological levels, it's right to use. It should be used under control. Thank you for listening, best regards.